abroad here at Tulane. This is the third module in the Global Perspective series, and they are designed to engage the Tulane community with local and international partners in discussions on important interdisciplinary topics and global themes. I encourage everyone to actively participate in the discussion and reflect on the ways in which we can all view the world from multiple lenses. So before we begin, I'd like to mention a few housekeeping notes to ensure the discussion runs smoothly. Please make sure your mic is muted when others are speaking. You can unmute yourself or type in the chat box when you have any questions or comments. Be sure to practice take space, make space, meaning we encourage everyone to share their thoughts and questions. However, it's important to give others the opportunity to participate in the discussion. Try to speak from your own experience and own your intentions and impact. Lastly, push yourself to think critically and remember to respect others as experts in their own experiences. We're lucky to have students joining us from many countries. While the conversation will be primarily in English, feel free to speak in Spanish, French, or Chinese, as we have people listening who will do their best to translate if needed. We want everyone to feel welcome. Again, thank you all for joining us today. I'm going to turn it over to Sienna Farrar, another study abroad advisor, with a brief message before we get started.
Yeah, thank you all so much for coming. As Amber said, this is part of our larger initiative this semester during this time of really low global mobility to connect our Tulane students to students across the entire world. And we will have more events. You can see them on our website, global.tulane.edu, if you want to come and participate. They'll be going for the rest of the semester. So back to you, Amber.
Great, thank you. All right, so we'll just dive right in and get started with the interview and discussion. I have some questions to begin the conversation, and hopefully eventually you guys can all participate in the discussion as well if you feel comfortable. So first, why don't we go through our panelists again. You can introduce yourself and kind of talk about your work, how you got to where you are today, and your relation and your work relation with the COVID-19 pandemic. So does anyone want to start? Yanti, you can go ahead.
Oh, okay. Hi, everyone. My name's Yanti. In relation to COVID, I can start from where I'm currently at. I'm working as a medical monitoring manager over here at the COVID Center in New Orleans. Before that, in terms of COVID, I was in those very first days when we realized that COVID was here in New Orleans. And I was working at UMC in the ER and was one of the first healthcare workers to do some ruling out of patients who did or did not have COVID. And I can tell you, we didn't know enough. So that's it.
I can go next. So I'm Pippa. I'm originally from the Bahamas, but I've lived in Denmark for the past 2 years or so. Like Amber said, I work at DIS currently with the Science and Health program. So I actively work with the students who are seeking to one day become doctors, hospital administrators, public health leaders, and similar professions in the future. Right now, working with COVID for me means how do we continue to educate students such as those attending Tulane or other universities around the US, and how do we create a space for them that lives up to the DIS standard of giving them experiential learning and, you know, giving them a different experience of learning about different healthcare systems to compare with their own while still complying with the COVID regulations.
I can go next. I'm Kristen. I'm originally from Pennsylvania. I studied abroad with DIS in fall of 2013 in the neuroscience department. And then I returned after I graduated to work for DIS, also in the science and health department. And now I'm back in Scandinavia, but in a different capacity. I am studying for my master's in the global health program at Karolinska. So I moved here quite recently, actually, at the end of August. So I've been navigating the COVID policies and that transition as well, as I'm sure you guys are all familiar with. So
All right, I guess I'll go next. Can you hear me all right? Super.
Yes.
All right, so I work at DIS in Copenhagen, but I live in Sweden. So I've been following both what's going on in Sweden and in Denmark. And with COVID, I've been looking a lot at media reporting and social media and looking at the way that sort of misinformation, sometimes complete fake news gets spread. I saw an interesting tweet when I was doing research today. Someone was saying that he took a vitamin C tablet every hour and was convinced that that was why he wasn't getting COVID. So there's all kinds of information out there, and that's what I've been doing a lot of my research on, looking at what's getting reported in the news and how and who's spreading it.
Interesting.
Great. Does anyone have any questions right off the bat for any of the speakers? Also, feel free to ask in the chat if you don't want to talk. All right. Well, I'll just start off. This will be more geared towards the those in Scandinavia, but kind of what is it like navigating life in Scandinavia? And I don't know if you've heard kind of how it's been in America, but maybe speak to how it's been different there.
I guess I can kind of talk to, speak about the transition anyway. I was in Philadelphia up until the end of July, and we were pretty strict about our lockdown, and also there was a pretty high adherence to using masks. Pretty much everybody would wear a mask outside, in stores. Even if you were going on a run, it was like recommended that you wear a mask, and most people did. And then now that I've been here, it has been quite different. There is not a mask policy, but there are guidelines that everybody tends to follow. I think the guideline is that you social distance at a meter and a half. And that seems to work quite well. In Karolinska, the school is following a hybrid model. So we have some of our classes online and some of our classes in person. But when we're in person, we are still abiding by all of the social distancing rules. And there's a lot of hand sanitizer stations to make sure that we're washing our hands and staying safe.
Yeah, for me here, I think there was a lot happening obviously in March, and we reacted a lot quicker here in Europe than in the US. It was about a few weeks after. But with my work, I travel with students on academic tours throughout Europe. And so I remember when those first cases, those first numbers were increasing in Europe, I was traveling with a group of students in Poland and in Germany. And so there was a lot of uncertainty about these new terms we're hearing, this new virus, this thing that's affecting people that we can't see. And that was a very difficult thing to navigate. But I think one thing that was clear, at least in Denmark from the beginning, was that, you know, across the political spectrum, there seemed to be some unity in that there needs to be action, and it has to be a united front. So even though there might have been some disagreements on a more nuanced level with the political differences, there was a very much like, we need to do something and we need to do something now. And I think we've seen very strong leadership from the government. Not to say that it's without critique, that there's no critiques, but I think that's something that's been very clear to us here. And also, you know, Scandinavia is so well known for its welfare model and this social solidarity. So I think, again, obviously there are exceptions, and I can also speak about some of those, but I think you really felt that in the beginning that, you know, we were all in this together and we have to figure out a solution together and take ownership of this and of ourselves and of each other.
Mm-hmm. Yeah, and I can just kind of add to what Christian said. I think in the beginning, like in March, everyone was really worried, right? It was this new virus, we didn't know what was going on. And even though Sweden has had mainly voluntary restrictions. For about 6-7 weeks, really, people more or less, if they could, they would go into a sort of self-imposed lockdown. So people started going to the supermarket like once a week and bulk buying things instead of going every couple of days. People stayed at home as much as they could. Of course, there's some people that simply cannot stay home. You know, people who are working in the care sector, people working in supermarkets, they couldn't. But if you were like an office worker, you would work from home. I think what emerged though, sort of in May, June, we realized that most of the spread was in Stockholm, and there were some places in Sweden that had very, very little community transmission at all. And I think, especially like in Skåne, where I live, we realized that it wasn't spreading as much in the community. People started to slack off a little bit, especially it got warmer. And so I think in terms of the voluntary restrictions, I think we've all settled into this new norm. So it's more, everyone's much more relaxed than they were in March or April, but people are still more or less observing physical distancing. And we do have some strict rules. So nursing home visits have not been allowed. That might be changing in October. Sorry. It's not COVID, I'm just thirsty. There's a really strict 50-person rule, so you can't have any gatherings of more than 50 people. But there's also exceptions to that. So I think one good example is that, like in a cathedral, they can have 50 people at a service, but my local church can only have 30 people because the building is smaller. Mm-hmm. So it's about taking that 50-person rule, which is a hard and fast limit, but it also has to be adapted to the space. Commercial spaces also have to make sure that there aren't too many people. So today I went to the pharmacy and I had to wait outside because they don't allow more than 4 people in because it's a small building. I also teach at Lund University, and it's the same thing with like Karolinska. We're on a hybrid model. I used to teach seminars in small rooms. Now I'm teaching seminars in lecture halls because it's the same amount of people, but they want to have everyone spaced out. So I mean, in many ways, some of the restrictions are voluntary, but there are different ways of adapting, and we've all more or less adapted to this kind of new normal. I did want to just share my screen for a second, if that's okay.
Yeah, go ahead.
Yeah, I just wanted to talk a little bit about the Danish-Swedish border, because I think it's interesting. And I'm curious to know what people like on the other side of the border think about this, because it's been something that's been, yeah, it's been kind of difficult for all of us, I would say. So I'm not very good at using Zoom yet. Yeah, so you'll see, so Copenhagen's here, Malmö's here, Lund is here. And for a lot of people, at least living in, so this whole part of Sweden is called Skåne. And there's a lot of people who commute. So people either commute by the ferry here, or they take the bridge here. And the bridge is like, it's a huge symbol. I mean, so I live over here and I can see the bridge from where I live because it's huge. And it's really flat here, so you can see for a long way. And what happened was, I guess it was the Saturday after WHO declared COVID-19 a pandemic. So I think that would have been like maybe the 15th of March. Someone can correct me on that. I remember like the Danes shut the border. So unless you worked in Copenhagen, or like if you say like you lived in Malmö, but your partner lived in Copenhagen and your partner was going to have a baby, then you could go to Copenhagen. Like you had to have an actual reason to go. And it was really difficult for like Swedes living in Skåne. Like it was very emotionally difficult because I think we were just so used to, like going to Copenhagen would be like someone who lived in northern Kentucky and they wanted to go to Cincinnati. It's just something that was very like, the border wasn't really a border. And to all of a sudden have a border there, it felt like emotionally, almost like getting like stabbed in the stomach. And I think even now, some of my colleagues will say things like, oh, now the border is open, now we can go to Copenhagen. But I've had colleagues who say, oh, well, the border's open, but I don't want to go to Denmark anymore because of how they treated us. And the other thing about that too was that everyone looks at national statistics, which is really, it's, of course, I understand why you compare national statistics, but for most of the last 6 months, there's been more cases in Copenhagen than there has been in Skåne. So there's been way more cases in Sweden as a whole, but transmission for the most part has been lower in Skåne. So we've also not quite understood why we weren't being able to go to Denmark. And also we'd see Danes who would go from Copenhagen to Malmö and go shopping on the weekends and then go home, and we didn't understand why they could do that, but we couldn't. So it's been a really interesting kind of, I mean, a lot of people feel like, it's of course they're two different countries, but you can see on the map, I mean, it's completely connected. And in fact, this used to be East Denmark. It used to be part of Denmark. So it's been a really weird kind of relationship, I think, between the two countries. And sometimes it feels like the politicians in Stockholm don't understand how connected the economy is. So it's been a weird kind of thing. But I just wanted to share the map so you got a sense of how close they really are. So I'll stop now.
Yeah, Rachel, so I remember when all of that was happening and then the bridge closed, and how tough that was, I guess, on this side as well, because there are also people who commute the other way. But then also thinking about like Denmark cut all the border or closed all the borders and then slowly reopened, but reopened to Norway and reopened to Germany, but yet the borders were still closed to Sweden. And that took a really long time over these 6 or 7 months for that border to slowly open. And it didn't even open to the whole country. It was like this region, then this region, and then slowly it expanded to the whole country. So it was a very, and I mean, I knew of people who were like, oh, we can still go to Malmö, we can just drive and come back. And I was like, but should we? Like, we're not supposed, you know what I mean? Like, we're not supposed to be doing that. But yeah, it was a really, really like strong decision to close the border. And then I think a lot of people do question. I think a lot of people obeyed the rules, but question how and why some of these decisions were made. And was it just made out of a necessity to do something, or were all of the factors really taken into consideration before they actually came to resolution?
The other thing that was really difficult too is that for people living in Skåne, our closest airport is Copenhagen. So I had a lot of students at Lund who were international students also, and they were trying to get home, and they had flights booked out of Copenhagen, but then they weren't allowed into Denmark. So they had to rebook flights. They had to go to Stockholm or to Gothenburg. And supposedly, well, not supposedly, like the Danish government had said, it's okay if you're Swedish and you're abroad, if you need to fly home through Copenhagen, that's fine. But not all of the airlines listen to that. So I also had colleagues I had a colleague in New Zealand who was supposed to fly to Copenhagen, and she was denied boarding, had to rebook a flight through Stockholm. And from the Stockholm airport home, it's about 5 hours. So it's like quite an extra added expense and time. So yeah, it was really, I'm glad that the border's open now, but yeah, it's been very strange to have a border there that wasn't there before.
Yeah, I think, being a part of the EU, there's this, like this solidarity of open borders, freedom of movement, and all of a sudden that right to freedom of movement was taken away in a big way. Yeah.
I see there's a question in the chat from Julie. Could any of the presenters address COVID and vulnerable populations in the US, DK, and Sweden regarding communication and treatment?
I guess I could talk a little bit, Julie, what do you mean by vulnerable populations? Do you mean like over 70s, people with underlying conditions, or?
There is that. I guess I was thinking more about there's certain populations, and there's a lot of intersectionality as well, but I'm thinking often like immigrants in Sweden, for example. It could be different socio-economic in the US, or,
Yeah, absolutely. So it's really interesting. So it turned out very early on, it appeared that many of the cases in Stockholm were in the Swedish Somali community. And although it was difficult to know because of course, in the very beginning, we had small numbers of cases. And so at press briefings, reporters would ask very specific questions about who was getting COVID. And there were so few people that the public health agency had to always come back and say, we can't answer that question because of patient confidentiality. So someone would say, oh, well, we saw that there's 3 people that died of COVID. Did they have underlying conditions? And they'd say, well, we can't tell you that because of patient confidentiality. But now, of course, we can look at trends. In Sweden, we typically don't collect data on race or ethnicity. But of course, it did quickly become clear that people in a couple of neighborhoods were very, very affected. And those neighborhoods tend to have more people of a migrant background. And it was a difficult kind of conversation because, of course, there are racists in Sweden who want to jump on that sort of thing. And they want to say, oh, well, those people are like this or like that. That's why they're getting COVID. There was a lot of discussion that the public health agency hadn't put out information in languages other than Sweden. And naturally, the number one thing you want to do is make sure that you have information in languages other than Swedish. But at the same time, of course, people watch the news, even if they didn't speak Swedish, they watch the news from other countries. There was no way to ignore or to not realize that there was a pandemic and you needed to wash your hands. So there was this kind of racist discourse of, oh, well, they don't know how to follow recommendations because they don't speak Swedish, which is stupid because, of course, everyone's following news, they're talking to people, they know there's a pandemic. It doesn't, even if they don't speak Swedish, they know to wash their hands and to do the best they can. What was really interesting, though, I think what was really going on was that a lot of the people who lived in these neighborhoods were disproportionately working in shops, they were driving buses, they were working in the care sector, and other essential services. So they couldn't physically distance. That was really what it came down to. So I think from a very racist perspective, people started talking about that immigrants had a different culture. But a lot of it had to do with class. It had to do with the industries that the people in these neighborhoods were working in. And some of the neighborhoods are poor. You have more multi-generation families living together. So there's more reason for transmission there. But it was it's very, I think Julie said, it's very much of an intersectionality type of discussion there.
Yeah,
interesting. Oh yeah, go for it.
I was just going to compare it to Denmark. I think we've been having extremely similar discourse here where certain groups, particularly migrant groups, have been targeted in the public discourse as being, spreaders of the virus. But like you said, it's such a complex thing. And, what industries are these people working in? How are different governmental policies affecting how they're able to exist in these communities that can impact their health. Like you said, multi-generational homes, working in shops and those types of things. And even the Prime Minister of Denmark, she actually in one of her press conferences said something highlighting one of the migrant groups in a town where the numbers were spiking and got a huge blowback because it was it was seen as this very inappropriate thing to say, to blame it on one group, even if she did make it in what she thought was a passing comment or not the main point of what she was trying to say. But it's very present all throughout the public discourse, and it's something that a lot of people are beginning to take note of, especially as the discourse around race and intersectionality and all of these things are becoming a bigger global issue and a push to raise awareness and to create more understanding among different communities.
I was just wanting to add on to that. We're talking about Northern Europe. I'm Australian, half Indonesian, but live in the United States. And so I've sort of been privy to a lot of different experiences of how COVID has traveled around the world. And I think for me, COVID, when it was beginning to travel around the world, felt like a virus of privilege. In Australia, it was the very wealthy that brought it into the country. It was those that could travel to Italy and to be able to come back to certain suburbs in Australia. And that's where the first outbreaks happened. And then, of course, it was those who experienced health inequities generationally that had to live it and didn't have the, proper health means to be able to take care of it. I think that exploded in the United States because America is extremely accessible from all over the world. And of course, what we saw in America were those that are affected the most, were those who have had to deal with generations of health inequity. And I think there was a disconnection at the start of where the virus came from and how it was, but for most of the parts of the world, how it got there was because of people who had the ability to travel and a passport that could. And I think it's interesting when we look at sub-Saharan Africa, the cases there aren't as high. And, you know, I think about that, and like I work in Kenya and the numbers aren't there as high. And I think it still goes back, as what you said, to class. I think initially this virus was traveling around due to, you know, class. I think it's been put out there that certain immigrant populations are carrying it, which I think is extremely unfair. And yeah, so that's kind of my take on it globally. And yeah, but that's all I have to say about that.
Yeah, I think I can just add one thing that happened. Of course, the virus came to Sweden in many different ways, but a lot of it came from people who had gone skiing in the Alps. And
exactly.
Also in Denmark. It was
and
from Italy and Austria.
And part of what happens is that taxi drivers are disproportionately migrants. And so a lot of people flew home with all their ski gear and then sat for 45 minutes in a taxi with the driver, who then got sick, spread it to his or her family. And that's kind of, yeah, it's very much about, it turns into very much of a class discussion.
Yes, 100%.
Yanti, I think there's another question for you in the chat from Annie.
Oh.
Could you tie the discussion about targeting marginalized groups in discourse to discussions about hurricane evacuees from southeastern Louisiana coming from New Orleans right now?
Yes, that blows my mind, Annie. Of course. Could you also tie the discussion about it? Right, and so I'm not sure, well, I hope that New Orleans, it did make the news at the start of the pandemic, as I'm sure, as one of the hotspots here in America. Mardi Gras happened. Thousands of people came to this city. The virus came to the city. It was in the community before we, you know, could take off our costumes. It was already here. And COVID spread like wildfire throughout so many of our community, as well as all of southeastern Louisiana. And for many months, we have been combating COVID here, alongside just combating an isolation, a lot of education. And what's happened in the last few months, it's hurricane season. And now we are having an intersection of two disasters, which you never thought would happen in your lifetime. We have a global pandemic, as well as, you know, two quite deadly hurricanes that like hit us in the last 10 days. So we currently have just moved 12,000 evacuees from Lake Charles because they've got nowhere to live to New Orleans. It has changed the whole idea of what it is to manage a natural disaster. We usually in Louisiana would shelter evacuees like in large places. We're able to see everybody, we're able to take care of everyone. There's a lot of visual stuff that happens when you're taking care of evacuees, and we can't do that anymore. We can't even put people on buses safely. And so this conversation of like, what is the most important thing here? I mean, is it a roof over your head and shelter, or is it protecting people from COVID? And whereas still the Department of Health here in Louisiana and New Orleans is dealing with every single day. The more we have people sheltering in place in New Orleans, the more our COVID numbers are driving up. And so every single day we have to sort of manage this. And going back to our marginalized evacuees, we have a high immigrant population coming out of Lake Charles that is here. For example, right now I have a patient over at my COVID hospital who is an immigrant, doesn't have paperwork, has COVID, needs oxygen. We can't send him to a group home. There's so many different lines of barriers, I should say now, that we're having to intersect with. And I'm impressed. And I know America's getting some really bad press out there in the world, but I'm extremely impressed by the healthcare workers of Louisiana, particularly the public healthcare workers, and how they're managing double crisis. It's something that we never thought we'd have to run into in our lifetime. So there's certainly different perplexing problems that come up every single day.
Yeah, actually, I think it's such a great point that you make, because when I've been studying media discourse, and there's this discourse, at least internationally, that America's such a disaster, they're doing such a bad job at handling the virus. And I think it's really unfair to the health workers, the people who are like doing a fantastic job every day. But it is this blanket discourse of America's doing such a bad job. But there's a lot of people who are doing a really good job.
It is really hard to hear that. But I think now, working within the government and being an immigrant myself to the United States, and seeing how these 52, is it 52? I hope I'm right, or 54 states operate as own little countries like they are in Europe. And right now I look to our governor, I look to my head of public health for the state. And it's interesting, like Louisiana, we've put our head down, we're dealing with these crises, and then you have Texas who are like, we're not going to wear a mask. And then Florida's like, what virus? And they're right next to us, right? And so that's also a little similar to like a border. We have to live in the same landmass, and we're trying to figure it out together, even though the ideals of like people are just next door to us, very different to what we believe. So when I look at the United States success rate, I know overall the messaging, and that's my biggest gripe, the overall messaging initially was political as opposed to for safety, and it's got us in this mess. I do believe that internal messaging, if you look specifically in the state, that, whatever state we're focusing on, I think they're really trying to do their best with what they were given, considering there was terrible messaging initially.
I have a question for the panelists. From this thinking about study abroad, thinking about travel moving forward, and the shifts that are going to have to happen in order to kind of take a public health approach in order to make that possible. And how, what are your thoughts or suggestions about what it will be like for us moving forward to travel again, and how, what kind of conversations should be happening between public health experts and the travel industry in order to kind of chart a new path forward for managing the current reality?
If there was a unification of messaging, if we could all agree how to protect ourselves, which in my mind is reasonably, I don't want to call it simple, but straightforward. I do think that we can creatively navigate what our world is right now. I just think that from one country to the other, it would help if both were on board at the same time, and agreed with what precautions both places had to take. I don't know how that's going to happen. It's very utopic, but that's how I feel like if I was to use like a school, I'm working in schools here in New Orleans to help reopen, and I'm creating policies around that. And the first thing that I educate people on, or try to, is the mindset about assessing risk and understanding risk and being able to assess what's low and high risk, and pair that with like some simple principles, social distancing, a mask, and testing. We can open schools. We just have to creatively think about how. And I think that we can do that with travel. But everyone on either side has to be on board.
Yeah, I second Yanti on that. I think it's going to take a lot of agreement and coordination, but also a lot of creativity Like right
Yeah.
now at DIS Copenhagen, we have a small group of students, about 60 students, and we usually have about 1,200, right? So we're really using them, and, you know, we've put in an agreement with, you know, their home university and recommendations here, come up with a common set of agreements of what we believe are best practices for those students as they experience their semester here, and what makes the most sense for people, you know, the faculty, for instance, on the Copenhagen end or the Scandinavian end, and students who are re-entering or entering Scandinavia for the first time from a very different reality across the pond. So how do we bring those two experiences and existences together? And I think our faculty have tried to come up with a lot of creative ways, especially as, you know, we want to focus on experiential learning and hands-on learning. And how do you do that when you have to keep social distance? How do you do that when you have to wear a mask? So I think, you know, it's going to come with trial and error, but I think we're starting to begin the initial phases of how to make that work in the best way possible for as many students as possible in the future.
I think you both said such great points. I think communication is so key, and making sure that everybody's on the same page. Absolutely. We had this really interesting discussion in class the other day about how international students are actually migrants, though we don't really call them that. And so how do we kind of support the process of having people from all different backgrounds come into a place and feel like they can be connected to the school, the system, and make sure that we take care of their health needs as well as their educational needs. I think that's super critical as well. Making sure that they understand the COVID regulations, and that they know how far apart they have to be from one another, and that we just adapt and grow together. I think international education is so important, and education in general is so important. So we're going to have to figure out these things eventually. I think strong communication and facilitation is really going to help. And DIS, I mean, they do a fabulous job of like coordinating. I think that's really their strong suit. So it's a testament to them that they were able to manage a pandemic and send students home and care for them safely, and then still have a group of 60 students in the middle of all of this going on. I think it really speaks to their ability to navigate all the different regulations that are coming out and communicate to their students and make sure that their best interests are being taken care of. So.
And I also think to extend even more that I think both parties, right, the students, the faculty, even the universities on both sides, like we have this common understanding now that moving forward, things are going to be different. So I think there also comes with a new appreciation of just the ability to be able to travel, how you engage with the places. I think students especially will try to, you know, enjoy that experience a lot more, because it was always a privilege, but even more so now as we move into the future, that, you know, really fully immersing themselves, really taking advantage of all the different opportunities they have that are offered. And also just the ability to be flexible, that, you know, you travel somewhere and a lot of things can change over a 4-month period in a semester. So being able to adapt that we might start in person in class, but at some point we might have to go virtual, but then we might be able to go in person again. Just having that flexibility to just kind of go with what happened, because these decisions are being made for everyone's best interest.
I think like speaking to that, and this kind of goes back to the mindset I was talking about in when I'm looking at the world, and you know, we're trying to rate who's successful at this and who's not. I think it does go back to looking at an individualist thinking as opposed to a collectivist thinking. I do feel as though our collectivist communities in the world are doing reasonably well. And like you're saying, in the university and your small communities with your teachers and your students, I think that a collectivist thinking is needed, as opposed to how's it going to affect me? How am I going to get home? What am I going to do? Like, we all need to do this together. And it does seem extremely foreign for those sometimes who live in the individualist countries, like, I can do whatever I want. And I think at this time in our life, it really calls for that. And it's not just macro, it's like very micro. And, you know, even the practice of going to the supermarket makes you think about thinking more collectivist than individualist and keeping space to take care of other people. So I'm right with you.
Yeah, I think that's a really good point. And maybe a question that I have is, how much do you think that individualist versus collectivist mindset is related to, like, for example, in the US, how things like mask wearing has become politicized? Like, is that directly correlated to that individual valorization over the collective?
I think sorry, you go ahead.
I was just going to say, I mean, for me, watching from my house, it's kind of shocking to me if you were to compare it to something equally as low impact health-wise. Like, imagine if wearing a Band-Aid on an open wound had been as divisive as like wearing a piece of cloth over your face has been. It's just, so I wonder from a healthcare perspective how much you see those two things interacting.
Yeah, I mean, I think for many of us, we're like, hey, just put on a mask and come on, let's just do this together. But when I'm looking at it at a huge macro level, I actually look at America. And for America, your greatest trait of like an opportunity and being able to speak up and your foundations of a country are screaming right now. Nobody tells what to do, and I'm going to decide what I want to do. And some of those traits are the best thing about the United States. But right now I feel as though that it is holding it back. And that is like an individualist thinking, but that is kind of, for me, where the heart of America is and why so many people want to come here. Yeah, like say, let's look at Indonesia and their historical precedents. They came from a military dictatorship. And currently, if you disagree with mask wearing, if you're not wearing a mask, or you say that, you know, COVID is a hoax, the government has you burying the COVID patients who died. It's very extreme in like how they're implementing what they need to do. And so I just think it's like, it is very interesting. I think when we just think right now for our generation, we can get very frustrated. But if we look at the United States entirely, I'm like, I don't want to say there's like, this is why, but there's generations of foundational freedom here of why people are opposed to wearing a mask. I completely disagree with it. Not to be political, but I think that it comes from that type of place. Australia is a little bit the same as well, although Australia has more of, you know, they love the rules in Australia, and so there's other different things that are getting highlighted. They fine people in the street $300 for not wearing a mask, and in America we would be like, are you kidding me? That's insane. So I think there is a lot to speak of between the individualist collectivists. There's probably negative things about historical precedents of military dictatorships. The people are just afraid to speak up because they're like Indonesia. They're like, I don't know what's going to happen. And sure enough, they're burying the dead. Like, I think at this moment, it's such an interesting time in public health, and why I think for you guys as students going into this world and doing public health, like, think about a history. Where did the country come from? Why are the people the way they are? And we can get the answers that way and hopefully form the answers to move forward. I think Americans, yeah, anyway, talking too much, sorry.
Actually, your comment made me think about the intersectionality of just oppression in general and why public health doesn't work in certain cases. Like, I'm specifically thinking about an incident that happened here in New Orleans. As you know, as some of you may know, New Orleans with itself, the parish, is not moving into phase 3, although the rest of the state is. And some people are very pissed about that because very simply, yeah. And part of that is because how can we, you know, first uphold public health and tell people, hey, like, keep in mind that there's a reason why we're not moving to phase 2, but at the same time, we're not providing them an economic means to provide for themselves, or provide for provide for their families. So people are facing situations where their businesses are closing down, or they can't, you know, there's no money coming in, no stimulus check, or all these other things. And so at this point, you just have competing interests. And so
Exactly.
I remember just having this conversation with a friend, just being like, how do you uphold, how do you encourage public health, but at the same time tell people there's no way for you to make a living and there's no social help per se to assist you in that matter.
Mm-hmm. Yeah, it's a huge conundrum. Both are valid, right? Maybe a socialized system, they don't even have to think about it. Like Australia, they're just like, what do you mean you have to pay for healthcare? Like, you know, parts of Europe, very different here in the US, but most countries aren't thinking of everybody else's countries, where they're coming from.
Yeah, I would.
Oh, go ahead. Sorry.
I was going to jump in and say, coming from a country with more of a socialist model, you know, when the shutdown happened here and people did lose their job, there's a much larger social safety net that people can depend on to help get them through that tough time. And of course, there's a lot of people who fall through the cracks of that. But I think that's one of the reasons why I think, you know, those types of public health initiatives or recommendations from those policymakers or people in charge, they come with an added level of support naturally within them. But I think also a part of it, at least in some of the I can speak for Denmark, maybe Kristen or Rachel can speak for Stockholm, there's also a big trust in the government, in the people that are sending the messages. So, I mean, now in Denmark, we have a mask regulation in public transportation, restaurants, bars, cafes, and bakeries. And that is new. We didn't have that at the beginning. So Denmark is much newer to the mask requirement, and it's still not regulated in every public space. But even though you hear people like, oh, this is, you know, like, why do I have to wear this? They will comply with it. They will pause before going in and they will do what the government has told them that they needed to do, even if it's at a personal level that they don't understand why or they don't agree with it. But someone in charge has told them that this is what they needed to do. It's a very united front. It's a very consistent message for the most part. And they kind of abide by it. So it is, very different systems to live and experience and live through.
Yep.
Yeah, I think one thing that's like about this whole trust and messaging, I think one thing that's been really interesting in Sweden is that we've had consistent messaging, but the government also like goes through and explains things. So it's part of the reason why we trust what the authorities are saying is because it's not like they say, do this, do that. They say, we need you to do these things because it will help this, it will help that. And so they go through and explain why there are measures. And I think that's also been really helpful because it's not simply an authority figure saying you have to do something, it's them explaining consistently, like every day. We have these, well, they're not daily anymore, but we used to have these daily press conferences with the public health agency. And they basically just said the exact same thing every day. So it was consistent messaging, consistently explaining what was going on. And I think that really helped. And because we had a lot of voluntary measures, the public health agency and also some of the government ministers kept saying things like, we trust you to be responsible. And so if you tell someone, you're responsible, I trust you, you can handle this, then that person feels like, oh, well, I can handle that. But if the government messaging is all over the place, if you're getting the message that you're not trustworthy, then you start to think, well, why should I even care? And I think it was like, I almost want to say it was like a Jedi mind trick where the government said, you know, we trust you, you're trustworthy. Oh, I am trustworthy. I think that was I think it really helped.
Yeah, I mean, I think that that's where in Australia I've seen it, that the government didn't trust Australia and they had one of the hardest lockdowns in the world. And I think that's because the government didn't trust the people. However, just sort of in contrast to that, I think that this mindset, like, it's helpful, but maybe in populations lower than 20 million people. I think the United States is its own unique challenge. It's almost 300 million people. I mean, I think we can only compare them to, say, China, Russia, and India. Like, I think maybe if we compared states' responses, we would be sort of on par to some of the smaller countries in the world. I think population, messaging, and all of that for a country this size. I think it is maybe possible, maybe not this time, but hopefully that is taken into consideration as well, of just the mammoth amount of people to educate with differing views based on their historical precedent of individualism.
All right, we have time for one more question. I see it in the chat. So Vasant says, in many cities, the influx of students has been detrimental to its population in more than one way because of COVID. What can Tulane students do to mitigate this effect in New Orleans?
Wear a mask, get tested, and message the right information, and think with a collectivist mindset. That would be my recommendation.
I would also encourage everyone to take it seriously. Just because you're not impacted doesn't mean other people around you won't be impacted. I feel like we have gotten very used to living with this virus that we've to some extent become numb to its impacts.
We're tired, aren't we? We're all tired.
All right, does anyone else have any last questions or last remarks they would like to add to the discussion before we wrap up? All right.
Thank you.
Thank you.
Yeah, it's really interesting.
Yeah. Yeah, so hopefully we were not only able to learn more about the ways in which different countries have handled COVID-19, but also about our role in working towards a better future amidst the current circumstances within our own communities. So I would like to say thank you to everyone who came out today, and also big thank you to all our speakers for taking the time to share your experiences with us. For the participants, if you guys are able, try to send an applause response if you can for our speakers. But if anyone has any more questions, you can reach out to me. I'll send out my email in the chat. And I can try to get you answers as soon as I can. But thank you all for coming.
Thanks, everyone.
Thank you for organizing.
It was great chatting with everyone. Thank you.
Thank you, everyone. Goodbye.
Yeah. Ciao, ciao.